Hey everyone, this is shot number 6. Um, I'm trying to change things up, with each video in this series, just to give you something different, a little bit more information in each one. I do have something special for the end of this one. It's kind of unique to anyone who might be low T and getting their testosterone, because I am now a patient with the VA instead of a normal civilian hospital. So, just got the needle out. We're going to take... Now I put it back in the box all the time because that's where the prescription is, but I'm going to take the vial out of the box here with the instructions. Now, as you remember, we're germaphobes, so we always clean the top of the vial. Very important. And then make sure your needle is tight. And then take the cap off. Prep it with some room for some air to get sucked into this vial. And this is something I want you guys to pay attention to this time, because this needle is actually getting pretty close to the bottom of the level, because this is shot number 6, right? So as you can see, I'm putting the bubbles into the vial, right? Pushing some air in so that it's easier to draw out, so I don't have that suction that slowed me down in the first video. But this vial is almost half empty, right? And I don't know how I'm going to get the last bit out. It's going to be a little bit hard, because I'm going to have to put the needle in just slightly, not all the way, so it's going to be hard to hold while I'm doing it. I'm already kind of weirded out by that. It's probably going to make a slurping sound like the straw at the bottom of a shake, I don't know. But we'll get to that when we get to it, right? That's a month or two away from now, because at 1 ml every 2 weeks out of a 10 ml vial, that's about as often as it's going to happen. Side effects that I've had this past 2 weeks. I really can't tell if it's because of my medication, but I have had some killer insomnia, especially this past week, and it did surround me meeting some famous people. Richard Dawkins, Catherine Stewart, Sean Faircloth, Greta Christina, all of them personally, and sometimes it wasn't anticipation. It was like after effects, but still, like, my whole week was filled with celebrities, so I kind of chalk it up to that, but I don't know, because how can somebody survive on just 2.5 hours of sleep and then not feel tired? I don't know, but it happened to me. So alright, so got that. Remember, we prep the needle because we don't want to put any air bubbles in us. Last time I did a close-up shot of where I was injecting. This time I have something special at the end of the video anyway, so we're not going to do that. So everybody who's needle phobic, you look out. Now we're prepping the area of the skin with the alcohol pad that we're going to stick the needle into. Pinch an inch and right down in the skin. that was pretty much the only change that I've had since my last video. Was I had some horrible insomnia, and knowing that I have to go to sleep but I can't. You know, I'm just not tired. And if it continues into this next week, and the week after that, where I'm actually not planning on seeing anyone famous, then I will know that it's something to do with the shot and not just my schedule. Okay, we got it all in there now. Kind of releasing on the pinch. I'm going to give it 5 seconds, and then bloop. And no drip and no blood. So we're good. Alright. So, put the cap back on. It's going to go back in the recycled detergent bottle that we're using as a sharps container. I'm going to give that tip out like for the rest of this series because that was awesome. This is what I wanted to show you guys. This is going to be unboxing Gov't Testosterone because I saw my doctor from the VA and he prescribed this to me to take over my civilian prescription. Now, mind you, this is the civilian vial right here. I have already opened it, but I kind of put it all back so that I could unbox it for you guys. So, there's 2 flaps in the government medicine. I don't know why they bought these special bags with 2 flaps, but the first flap, this one right here, has this flyer thing that basically is all of the instructions for the medication and contraindications and yada yada yada, and last page. And they just print last page on the last page. You don't even really need the last page. But should you get any medications from the mail, from the VA, please check for the other flap. You don't want to miss out. Okay, so open the main flap, and I've got 2 of these. Right now, with my civilian prescription, I had a box just like this. So I'm looking at it, and it's the same size box, but it's slightly different color. See the bands right there? There's purple, and there is green. So, yeah, and you don't see anything important. I didn't just doc drop myself, so cool. So these purple boxes, here's the funny thing. I'm going to open one here. It's got some instructions, and here's the vial. Now, just for reference, I'm going to stick it right next to the vial that I got outside of getting it from the VA. So, basically, you can see the level in there right away. It's very, very tiny. I'm going to take the cap off this needle and show you guys what I'm dealing with here. When I have to switch to these little vials, here's the needle and here's the vial, right? So if I'm trying to get, you know, stuff inside of this needle, I'll be having to hold the needle to where it only goes in just slightly, and that is going to be tricky. I don't like it. I don't like it at all. But I'm going to have to deal with that. Now, it seems that the VA is planning to send me 2 of these vials in a package like this every month. And I imagine part of this is security because they're sending it through the mail. In fact, I was told it all came from the same place. Some army base in Kentucky or Kansas. I don't know. This says it came from the Denver VAMC, so that's cool. But I would much rather go personally to the pharmacy in my VA hospital and pick up a big one, you know, to remove the whole security problem. Like, I know if a kid were to pick up these 2 vials and like steal my mail, they would not even be able to do 1 week's worth of bodybuilding off of my medication. And that's why they're sending it in such small doses. But this is a lot of postage, you know, every month to send something out. And to me, that's like money, like over every soldier that they're doing this for, you know, across the country. That's money that could go to another doctor or get somebody else into the program quicker. It took like half a year for me to get in. I've heard horror stories of 2 years. So I really, I don't see a way around it because they have to secure this controlled substance in a way that, you know, makes sure that nobody ever gets it stolen and abused. But I don't know. I'd rather walk right into the building every couple months, you know. I have appointments every couple months, so why not, you know, require people to pick it up in person and give them larger vials so at least they won't have to deal with these tiny little things every time they get their shot. You know, every time slurping. I don't know how this is going to work. So, until next time, people. And I still have some left in the large vial, so I won't be slurping out of the small vial next time. But it's about to happen pretty soon. And I'm not looking forward to it.